Patients often get only bits and pieces of information about their health, a lab result here, a prescription there, and that makes it hard to see the whole picture. But every time you visit a clinician, they're adding their own notes to your electronic medical record. If you were able to read those notes, it can connect the dots, helping you to become more engaged and more in control of your health. In a recently published study involving more than 20,000 patients over 7 years, 98% of those surveyed thought that having online access to visit notes was a good idea. Even more interesting, though, is that regardless of whether or not they chose to review their notes, 63% of respondents rated the availability of notes as very important for choosing a future provider. Let that sink in for a minute, especially if your hospital or medical practice doesn't make clinicians' notes available to patients. Hello and welcome to Data Point. I'm your host, Greg Matthews, and our guests today are Cait Des and Liz Salmi of Open Notes, a nonprofit organization that has helped hospitals and medical practices to make clinicians' notes available to over 40 million American patients, all without an app, a product, or a software installation. Their story is a remarkable one, and I have a feeling you're going to enjoy it. And now, Cait Des and Liz Salmi of Open Notes. Liz Salmi and Cait Des, thank you so much for being with us on Data Point today.
Thanks for having us.
Yeah, thank you.
This is something that I've been wanting to do ever since I saw the panel that you both were on at South by Southwest this past March. And I was so inspired not only by the work you're doing, but the way that you interacted with each other. I thought this is the perfect time to break new ground on Data Point and actually have two guests instead of one. So an extra special Data Point welcome to both of you.
Yay.
Thank you.
One of the things that I like to do on this show is, in addition to featuring the great work that you're doing, I want to give the listeners a little bit of context about who you are. And I wonder if you wouldn't mind giving us a little bit of background that points us to how you came to be where you are in this Open Notes movement. Cait, can we start with you?
Sure. So I am a health services researcher. I come out of the public health world, and for a long time was interested in working on issues related to how clinicians make decisions within the organizations that they work in. Mm-hmm. And that sort of focus led me into electronic health record adoption, how and why clinicians were and were not using it. And, in a way, Open Notes is kind of a perfect example of that. So it is a technology related intervention, but it also requires an enormous amount of culture change. And those kinds of issues are so interesting to me. And so Open Notes really sits right in the middle of that. It has the additional benefit of actually being really beneficial for patients. So it has an additional sort of, this is really great work to be doing.
And how long have you been in the field? When did you start that work looking into, how and why clinicians were using the EHR, for example, and studying those cultural issues?
So I started working on that during the second Bush administration, when David Brailer was the first national coordinator for health information technology.
Got it. Okay, that is good context to have. And that actually, you've seen much of the true evolution then of the platform and the way it's been used and how it integrates into the provision of care. That's excellent. Liz, your story is a little bit different. Give us a little background on how you came to be involved in Open Notes.
Sure. So it's interesting hearing Cait's story because I think I'm paralleling that story, but from a patient perspective. So I have a background in communications or digital communications, and I didn't work in healthcare, but I was diagnosed with a malignant brain tumor in 2008. And so I became a patient. And what was exciting for me, I guess, or one way I managed my care was this online patient portal, the health system where I received care. I had been there for 3 years prior to my diagnosis. I was already using this patient portal to set up appointments and email my doctor and order prescription refills. So to me, and I was, 22, 25, 26, 27, 28 at that time, to me, healthcare was this portal, this digital tool. And that's just how I did things. And so when I was diagnosed with a brain tumor, I continued to manage my care that way. And I moved along, and because my background was in digital communications, I became one of those patients who started blogging about my experience and started going on social media, talking about what I was going through. And eventually, in time, I met a whole bunch of really cool other patients, the e-patients, and I was inspired by the e-patient movement, what people like Dana Lewis and e-patient Dave were up to. And that, in time, got me connected with the world of the Stanford Medicine X community. I became inspired to start working in healthcare and not the nonprofit space. I started becoming curious. And some of these e-patients are just so inspiring to me. I thought, wow, they're so sciencey. I have no idea what role I have. I don't know if I could do what they're doing. But one day, many years later, in 2016, my health insurance changed from the system I was at. And I realized, oh my gosh, I got to pull all of my information in that portal and take it wherever I'm going to go. How do I do that? So I learned about that whole medical records request process, which is really takes a lot of time and effort. Sometimes people have to pay money to get access to the records. And I went through that process, and it was enlightening, but also I had a chance to read my full medical record. And I realized there was a whole bunch behind the scenes that I did not have access to and was not privy to through the online patient portal. And that's where I stumbled across my doctor's notes or my clinical notes. And they were really exciting to read. And as a patient blogger who had been chronicling my experience with a brain tumor since 2008, I read the record and thought, this is the same story, but written from a different author, a different voice than my story. And so in time, I learned about the Open Notes team, and it was about giving patients access to their full medical records. And I officially joined the team in 2017.
Let me ask you, Liz, because I find this really interesting. One of the, I guess, common pushbacks that I have heard relative to physicians being willing to share notes with patients, or hospitals being willing to share notes with patients, is that they're so technical and so deeply, clinically convoluted that a patient wouldn't be able to understand them. Now, I'm guessing that you probably had a relatively complex medical record as a brain tumor patient and survivor. Can you tell us a little bit about what your experience was like in terms of sort of deciphering what you found in there?
Yeah. So what I thought looking at them was, of course, I had the perspective of now a person who at that time was 8 years post-diagnosis, but I was in all of those visits. So I was there when they said all the things that they later put into a note. And while the doctor or other clinician might use more medicalese and some fancy words, they were things I was able to decipher just based off of context. And when I went through the note, if there was a word or phrase that I hadn't already been introduced to, I just went to Google and searched the phrase. And I was like, oh, that's what that acronym means. Or, oh, that's what that word means. Yeah, I remember them saying that. They just said it differently to me. So
exactly. Yeah. Oh, man, it's such an amazing thing. And I want to get into, before we go too much further, what actually is Open Notes? Is this a software tool? Is it a platform? What is this thing that you guys both work for? Cait, can you give us sort of the headline view of what we're talking about here?
I can. I'll start just by saying there is no software. There's no app. We're not coders. We, in fact, don't even know how to do that, or I'll just speak for myself. I don't know how to do that. What we are is a foundation and philanthropy funded group of people who are pushing to spread more transparency in healthcare through sharing clinical notes. And we also study what happens when you make this kind of transparency available to patients and clinicians. So we're not selling anything beyond the idea of transparency. And we started out as a pilot project in 2010. And on the strength of that pilot project, we received a pretty generous grant from several foundations to really focus on dissemination and spread, and then evaluating what happens for patients and clinicians. So from there, we started out as this pilot in three healthcare organizations with about 100 primary care clinicians and 20,000 patients. And so that pilot began in 2010. And currently, we now have more than 39 million patients who are signed up on a portal in a healthcare organization that offers access to notes. So we think we're at over 200 healthcare organizations that currently offer notes.
Wow.
That may be an undercount because we find out all the time about new organizations that we didn't know about who are already doing it.
So when these organizations, just to kind of paint the picture, when these organizations decide, yes, we are going to offer patient access to these notes, how do they typically do that? Or is there a typical? Do they announce it to their patients? Is there a flip that they're switching in their electronic medical record? Like, how does that transition happen?
So it happens and Liz, feel free to jump in here. It happens in a lot of different ways. So we have some organizations that really buy into the idea. They communicate with their patients about it. They communicate with their clinicians about it. And they really want to get to the place where the patients will start to see benefit. We have plenty of examples, though, of organizations that have turned it on and they don't tell anyone. They don't tell the patients. The clinicians don't know that it's really happened. And it's sort of open notes in name only. So there's a lot of variability.
Interesting. And Liz, I know you spend a lot of time on the ground with folks in these major practices and health systems. What's been your experience as people are sort of deciding to make that switch?
Yeah, the open notes at its core is just sharing notes. So how an organization decides to do that is different. Every health system, every organization has its own culture and process that they need to go through. So that's one thing we've seen across the board. So you've seen one open notes implementation. You've seen one open notes implementation. So I'll give a couple quick examples. You might see an example where, and I'll use Kaiser Permanente in the Pacific Northwest as an example. They had heard about this open notes thing. There were a couple folks in the organization who were champions. They set up a meeting about it. They invited their patient family advisors to the meeting, and then decision makers were there listening. And some patient advocates stood up and said, this is my health. I'm responsible for my health. I deserve to have access to my health information and to be able to see the full picture so I can make these important decisions that impact my life. And the leader, the main decision maker there said, all right, we're turning this on next week. Tell everybody. This is it.
That doesn't sound like the usual protracted 2 years in committee sort of decision process, does it?
But then there are organizations who are, then we see those who are open notes curious. So somebody starts reaching out to us asking for, do you have any toolkits, white papers, send us links to every published paper ever. And we do that. We help them. And then some organization has a champion. It depends on the political capital of that particular champion, but someone will start a pilot at their organization, and the pilot might be with a larger division, or sometimes it's as small as one health system said, oh, we're piloting. I said, where? And they said, sleep medicine. And I was like, how many patients go through sleep medicine a month? They're like, not that many. So you can't really tell, what is the response from patients. So they might pilot it to death, or maybe have a couple of pilots in different areas. And then in time, they turn it on. And then by turning it on, they flip a switch and say, everyone in primary care is now going to share. Everyone in cardiology, oncology. So they might do it department by time, and then and I'm getting really nerdy here, but then their individual switches and levers are how they might customize the onboarding process depends again on the organization. Is it mandatory they share notes? Is it you share notes, but you can click a button to opt out 1 or 2 notes just in case that there's like a patient safety concern? Or is it they must opt in for every single note they're sharing? And
that's really entirely up to the organization, right?
Yep.
Yes.
Fascinating. Okay, we are going to take a quick break, but we are going to be right back with Cait DesRoches and Liz Salmi on Data Point.
Today's show is brought to you by BlueSpire, a full-service digital marketing agency focused on complex and highly regulated industries of healthcare, senior living, and financial services. Rapid changes in the healthcare industry are causing consumers to seek out trusted advice, demand more transparency and access to information and content. With over 30 years of healthcare experience, BlueSpire knows how to help you reach, communicate with, and gain trust from these consumers. We help you engage with the right content at every touch point, from the first symptom search to appointment scheduling through care management. Visit us at bluespiremarketing.com to learn how we can help you deliver relevant, engaging content through ever-changing touch points that matter.
Welcome back to Data Point. I'm your host, Greg Matthews, and we are here today with Cait DesRoches and Liz Salmi from Open Notes. Ladies, when we went into the break, we were talking about the implementation of Open Notes within a hospital or a health system. But I wanted to come back a little bit to some of the why this is important. And Liz, when we were talking about your personal experience, you mentioned that even though plenty of those notes were, pretty abstract and fairly clinical in nature, you were able to get yourself to understand almost all of them. I'd love to know, is that a normal experience? Is that something that you've seen repeated throughout time, or is Liz kind of an unusual case?
Well, Liz is a fabulous person. But we have a lot of survey data that shows that patients say they understand the notes. And what I think is happening is exactly what Liz said. They were there at the visit. They heard it. And they remembered at least some of it. And they're understanding enough of the note to get the gist. And reading the note helps them to remember what they heard. So it's something that we hear repeated all the time, that even though clinicians are worried, they're either worried, they're creating notes because of their EHR system that they think are just garbage, or that they're so complicated that they will not be useful for their patients. But what we hear from the patient side is, bring it on. I can understand this. And if I don't understand it, I'll find a way. I'll find someone to help me.
Man, that is so exciting. And I know that, Liz, you mentioned that, some of the institutions want to see every paper that's ever been published on this subject. Let's talk about that for a second. I mean, is this something that since its inception has been widely researched? And are you doing all that research, or where's all this coming from?
So we recently did a review of every paper that we are aware of that's been written about this concept of sharing clinical notes, to really get an assessment of the evidence base for Open Notes. And we realized there were about over 90 papers written on this concept, 88 of which were published in peer-reviewed journals, and about 30% of those papers were written by people coming from organizations that have nothing to do with our Open Notes research network. So just other folks who are studying this phenomenon as in their own organization as it gets implemented. And that 30% were published relatively recently in 2016, 2017, 2018. And so to us, it looks like it took this Open Notes research team, to get the ball rolling, to do the first big studies. And then now as it's being disseminated and adopted at these over 200 organizations around the country, they're starting to dig in and do their own research, which is really validating. I just want to say, we don't own the ability to do research on this concept of Open Notes. We want other people to go out and research it as well.
And have you, as an Open Notes research organization, been able to tap into some of that other research to, drive future studies that you may be involved with? Is that a role that you play in that ecosystem?
We do that. So we do a lot of scanning of what's out there. We use the research that other places have done. And in particular, there's a lot of really great stuff that's come out of the VA. So the VA has been all open notes for quite a few years now, and there's some excellent work out of the VA, particularly around open notes in mental health. And so we use a lot of other researchers' work in our own dissemination work. We're always looking for partners. So we also kind of keep scanning out there to see if there are others who might like to partner with us on other pieces of research.
I noticed last week that there was an announcement about a piece of research that was published recently that really struck me, in part because of the scope and scale of it. A 7-year study looking at over 20,000 patients. And one of the key findings was that 98% of the participants thought online access to visit notes was a good idea. Mm-hmm. That is a pretty shocking figure.
Yeah.
Can you tell us, Cait, what do you see behind that? What is it that drives people to think that it's such a good idea?
So patients read their notes for a number of different reasons. They read their notes to better understand their own health, to recall their care plans, and to try to really understand why was this medication prescribed for me, things like that. They also are curious about their health. They are curious about what their clinicians are thinking. So the note is like sort of a nice window into understanding what the clinician is thinking. And it also conveys benefits for things like, I really want my spouse to know this thing about me, or I wanted to go to my mother's doctor's appointment, but I couldn't get there, and instead she shares the note with me. So it helps with getting care partners involved, and it helps individual patients to really sort of understand, remember, and kind of make more informed decisions about their own care. So all of those benefits we saw in the original pilot that was done. And then when we went back 7 years later to our original pilot organizations and asked a bunch of some of the same questions, some new questions, we are seeing they're confirming these benefits again. So one thought that we had was, well, some of the pilot results could have been related to just the novelty of the study. But what we're seeing is they really persist over time.
One of the things that struck me about the results that were published was that 73% of the patients said that having access to the notes helped them take care of their health, and they felt more in control. And so my question is, does having that agency and that empowerment, that feeling of being in control, why is that so important? And is it something that you see happening regularly as you're interacting with patients?
Yeah. So the unfortunate part is not all patients have access to their notes or know what notes is. So as far as all patients, I can't necessarily speak to them. We do see from the data that patients who read their notes and know what notes are, and this new study that's published are of the responses of folks who say they read at least one note in the year, in the last year. That's what they're saying. And as an individual who asks for my notes, I don't have easy access to my notes now where I receive care. But as an open notes person, I ask for those notes. And from my personal experience, I think it's funny because here I'm a person living with a brain tumor for 11 years. Clearly, I'm knowledgeable in me and this topic. And yet when I read that note from my last visit, as I'm planning for my next visit, I'm always surprised by how much I forgot from the previous 6-month period. And I'm thinking I'm smart, man, I know a lot about brain tumors and me. And then I read it and I'm thinking, I'm going to ask her, do I still need to take this anti-seizure medication? I mean, really, it's been 10 years. Do I need it? And then it says, once again, Liz and I discussed, does she need to be on the same medication? I described to her how her life would change if she stopped taking it and she had a seizure, blah, blah, blah. And I'm like, oh my gosh, I've been asking that same question over and over again, and yet here it's documented. When I read my note from my last visit with my neuro-oncologist, I prep for the next visit, and I realized that a lot of the questions I thought I was going to bring to the visit are stuff we've talked about in the previous visit. So it reminds me and reinforces that we've had these conversations, and I better understand why I'm on the medications that I'm on. And I think many of your listeners might think, wow, well, Liz works for Open Notes, or Liz is clearly an engaged patient who knows lots of things. But really, when it comes to your own health and living with a serious condition, it's hard for people to really keep their head on straight. A lot of things just kind of pass over you. I know that one of my Open Notes colleagues talks about research shows if you're getting bad news in a visit, you only remember maybe at most 30% of that visit. Wow. And there's no way, even if you're getting good news, like everything's clear, you can't remember everything that's said at a doctor's visit. So to be able to go back to a document that's written by your own doctor as a record of what happened is just so satisfying and validating, and it's just a good tool.
You hit something there, Liz, that I want to pick up on, and that is you're planning for your next visit, right? So you're going back to your notes and doing a review. Cait, in our pre-interview, we were talking a little bit about a pilot program that is related here. Can you give us a sense of what you're testing in this new pilot program?
Sure. So we're increasingly interested in the idea of patients co-generating the note with the clinician. And so we're piloting a project, we call it Our Notes. And in Our Notes, patients are sent an email a few days before an upcoming visit, and they're asked to write the subjective portion of the note. So what's been happening since the last visit? How are they feeling? And then they're also asked to generate an agenda for the upcoming visit. So what are the most important things they want to be sure they talk about? And so we're piloting it in 4 places in primary care, and it's still early days. So what we can say so far is we know it's technologically feasible. We're working with 2 different EHR systems to implement it. So we know it can be done. Okay. And we know that patients will do it. So not every patient who's invited to do this before the visit does, but a fair number of them seem to be responding and filling things out.
So I'm going to ask you both to put on your fortune teller's cap and grab your crystal ball for a second. I'm really curious if patients are setting, they're suggesting their agenda for the upcoming visit. How do you think their doctors are going to respond to the patient driving the agenda in that way? Liz, give me your best prediction.
I'd say the best prediction is doctors are going to like this for 2 reasons. One, patients already do this. We just write it on a notepad or in a journal or in our phone in the notes tab. We put questions there and we ask. And if you're dealing with something serious, you're there with your notepad and you're answering questions. I think what might throw doctors off is if it's somehow connected to the EHR and they feel like we're intruding in their space, or if in some way it might impact their workflow and they might have to work more. And as long as this tool shows that it's not going to add to the hours that they're working, I would think that they'd be in favor of this.
All right. And Cait, your turn. You've been studying physicians' engagement with EHR platforms for probably as long as anybody. What's your take?
My prediction is that they are going to like it. And for 2 reasons. One, getting someone else to write a portion of the note for you decreases the amount of work that you have to do. And that's one of their main complaints about the EHR. It's just it creates more work for them. So cutting down on some of that charting work that they do, I think they'll be in favor of that. The other reason I think that they'll be in favor of it is it helps to head off the doorknob question. The question as the physician is headed out the door. They have their hand on the doorknob, and the patient says, "Oh, I have one more thing I want to ask you about." And it's often the most important thing, or it's the thing that's really weighing on the patient's mind, that maybe they're uncomfortable to bring up. They're not sure. So it can help to head that off by giving the patient time in advance where they don't have to say that thing. They can just write it down.
Got it. No, that's fantastic. Well, I think we're all going to need to stay tuned to opennotes.org to see how that research unfolds. And it's kind of hard for me to believe, but we're near the end of our time here. I wanted to ask a question about the future before we close out here. And I know that there obviously has been so much from a policy and regulatory perspective in the last 10, 15 years that has changed in terms of the way that we use technology to track medical records and so forth. What do you see coming in the future that may impact the future of the sort of the open notes movement from a policy and regulatory standpoint, for good or for ill?
Well, I'll take the first shot at that, and I think what we should be expecting in the near term is already on a lot of our phones. So Apple has a functionality that's native to the iPhone that allows me to authenticate myself. It goes to my patient portal at Partners Healthcare, and it pulls all of my data, all of the data that Partners lets me have through the portal. It pulls it into my phone.
Okay.
And with what's in the 21st Century Cures Act, which says that patients have a right to access all of their electronically available information, coupled with what ONC is doing around new pieces of data that have to be part of the interoperability data set, I think what we're going to see is this explosion of third-party app developers who are figuring out how to pull your information into your phone, into their app, use it and create sort of templates that are really useful for patients. That's what I hope. That's sort of my kind of rose-colored what I hope happens. I am a little bit concerned, though, that many of these apps have, none of us read our terms and conditions, if we're being honest.
Of course.
No one, when you download an app, you don't read those terms and conditions, you just click it. Yep. So in a way, even though this new type of technology will give us more access to our own information, we may sort of unwittingly be giving access to that information to everyone else as well.
Interesting.
So I think we're at a time where this technology is changing so quickly that our regulations and laws and thoughts about who owns my data and how do they get to use it, I think we need to have more conversation about that.
Excellent. And actually, I want to point one more question at Liz before we go here, because this is another thing that I found really intriguing, and something that if you work for a hospital or health system and are listening to this, I want you to pay really close attention to this question and its answer, because in the research study that we've been talking about, another of the findings was that 63% of respondents rated the availability of notes as very important for choosing a future provider. So Liz, first of all, can you tell us, if you're out there and you're a patient and you want to know, does my hospital offer open notes, and are they part of the open notes research protocol? A, how do they find that out? And B, if they're not, what do they do about it? Good
question. So on the Open Notes website, we list everyone who's officially sharing notes. They're out, they're proud that they are an Open Notes site. You can go to opennotes.org/map. We have a map of North America. You have your mouse over which state you're in, and you'll see those organizations that are sharing notes. If your health system does not share notes, it's hard to say, what can you as one person make change? Can you make your entire health system suddenly start sharing notes? It's not going to happen overnight, but organizations do and should listen to their patients. So you can ask your doctor. You can get the ball rolling. Find out if your hospital or health system has a patient family advisory council you can talk to about this, that you could put a request in together. I, as a person who's on Twitter, and there are a lot of activated patients who are really interested in this, they have conditions, they want access to their notes. I get people texting, tweeting at me often saying, how do I do this? And I say, look up your health system website, look who's in the leadership, and email them about this and cite some of our research, because just your story is important, but also them knowing where the literature base or what's in the evidence base is really important as well. So I kind of prompt them with some of the tools they might need in order to get this ball rolling, and suggest they might look into people like the chief medical information officer, who's usually the person within the health system who's looking at things like open notes and already aware that it exists.
That's a great tip, and I think it's a fantastic way to close us out here. For the listeners, I want to let you know that I'm going to have links to the research we discussed, as well as information about how to get in touch with Cait and Liz. I really want to thank you for being here and being a part of this experiment. First time we've had two guests here, but the work you're doing is fantastic, and I'm looking forward to following it for a long time to come. So Liz Salmi and Cait DesRoches, thanks for being with us on Data Point today.
Thanks.
Thank you.
Thanks so much for listening to the Data Point podcast. If you like what you've heard, please do rate, review, and share it with your social network. It means a lot. And if you have ideas for show topics or guests, please email them to me at greg@healthquant.health, or send a direct message to @ChiMoose on Twitter. That's CHIMOOSE on Twitter. For more information about this show or any of the terrific healthcare podcasts in the Touchpoint Media Network, check them out at touchpoint.health. See you next time.
This has been a Touchpoint Media production. To learn more about this show and others like it, please visit us online at touchpoint.health.